really rested on that increase money and personnel.
Can you hear me back in the back door? Good. So in elementary school, we'll be turning the lights off now to get the attention. Thank you. Thank you for being here, folks. We know that there's lots of other things you could be doing, so making the choice of being here for presentation on transportation, we appreciate your presence. And Skip is handing out the tricolor handout. If you don't have that, there's extra ones over here. He's also handing out some information that John brought with him today. So our speaker today, John Mazzello, is the Deputy Director of the Human Services Coalition of Tompkins County. His organization provides valuable information, connections, and referrals regarding crucially important topics in people's lives. And this morning, he'll be speaking about transportation. So I'm not going to give a typical introduction for John and tell you where he hails from or what colleges he went to, or give you a list of his work history. I can tell you that John is very knowledgeable about the delivery of services in Tompkins County, and that he is well connected to those in other agencies. But even more important, I know personally that John is a generous person. He was willing to give of his valuable time on 2 separate occasions in one-to-one meetings with me. And just last Monday morning, when we both learned that the staffer who was to have presented today would be unable to do so, this was last Monday, John immediately and graciously agreed to spend his Sunday morning with us. So we appreciate that generosity. So, John, a warm welcome from Lansing United.
Well, thank you, everyone. I'm so glad to be here. Thank you for the invitation. I hope that my presentation makes some kind of orderly sense. I did put it together this week, but I think I've got a story to tell that you'll be interested in, and certainly am very interested in your process too. Outside of my work role, and I'll talk about that in a second, I'm the church council president at First Congregational Church. So I'm very interested in your planning process. I'll have my eye at the end when you start to do your own talking, because we're going to be thinking about our own. And, what a good idea! So it may steal some of your ideas. So this morning I will talk with you about transportation, but I'm going to start with talking with you a little bit about what we do as an organization at the Human Services Coalition. And part of that is because I'd like you, as you're thinking about how you respond to needs, and I know you've heard from some folks last week about affordable housing, and next week about childcare and services for children, thinking about the way that different needs and services interrelate for people who need some assistance. So when we talk about transportation this morning, thinking about, well, these may be some folks who also need assistance with childcare, or maybe the reason they have transportation needs is because they've been priced out of where they want to live, and now they're living farther away, and they don't have 2 stable, reliable cars for their family, and they have to get transportation help, but they also are not living where they want to live, and they maybe are in a place that is not really ideal for them, or not really affordable, or what have you. So all of these needs, in our work, we see do fit together, and people are complex, and so as we think about planning, it's really important for all of us to put our minds, put ourselves, try as much as we can to have empathy and think about the folks that we might be supporting through the work and the planning that we do. So I'll this morning just talk with you a little bit about what we do at the Human Services Coalition. I'll talk about the program that is my direct one who reports directly to me. It's our 211 helpline, and the transportation services that we do within that. I'll share some things that I think are helpful to know about Tompkins County's transportation needs and some thoughts about Lansing a little bit. And then I'll wrap up with some opportunities or questions for you all as you get together at your tables, some things that I would think about or that I'm thinking about in our own transportation planning. So just to give you a breakdown of the Human Services Coalition, our mission is to advance effective and equitable health and human services in Tompkins County and the region by helping to shape systems, strengthen community organizations, connect people to resources, and lead collaborative efforts to create lasting positive change. So I think, what you're thinking about through your planning process here seems to fit in really well with what we're talking about. We really envision a community that embraces the dignity and well-being of all people, supported by a strong, vibrant, not-for-profit sector. Our organization was founded in 1975, so just more than 50 years, just a little bit more than 50 years ago, by City of Ithaca, Tompkins County, the Ithaca City School District, and the United Way, really around how do we coordinate, collaborate across our not-for-profit and human services systems to be able to be effective and helpful to people and not get in each other's ways and rub up against each other. But how do we do things together and be more efficient and effective that way? We have a number of different program areas. I wish I could talk about this for the next hour. In fact, I did that on Friday. I talked to another group for an hour about our different services. You don't want to hear me talk about this for an hour. You will glaze over and I'll be heading for the food. But just to tell you our 4 big program areas. Human services planning is our kind of umbrella human service not-for-profit support area. We work with all sorts of organizations to help build their capacity. We have a workshop series. We have consultants, a pool of consultants that we draw upon to help organizations to think about what are some of the needs they have and how might they respond to those needs. We have training and capacity building grants that we can direct to organizations, and we have lots of ways that we support the capacity of other organizations to do their work and carry out their mission. We have our health planning department that is similar, except around health particularly. We have a health planning council advisory group, which is leaders in both the clinical and non-clinical sides of health. We have a number of individuals who work with us in our organization who provide services to individual people. We have health insurance navigators to help people sign up for health insurance. We have a health advocate, which helps people to use their health insurance. If you ever got a surprise bill, thought that something should have been covered and it wasn't, that position can help. We also have a program that we're working on with Fuga Health to better connect referrals from the clinical side. If you've been to the doctor and they have you do the survey and it says, do you feel like your food is secure? How's your housing? And you wonder what happens with that, or what happens if I say yes. For a while, not a lot of stuff was happening, it was being held onto. And so how do we then make referrals out to organizations that can respond to those needs? So we're working on a pretty big project. We've got 25 organizations collaborating on one single data sharing platform to share those referrals out across Tompkins County. Our housing initiatives program is helping to coordinate all the range of services, especially for people who are homeless or at risk of homelessness. We've got about 30 organizations in Tompkins County that are working on homelessness, and many more people and individuals and downtown churches and outside of town churches and other organizations and businesses. And so bringing those folks together to work towards making homelessness rare, brief, and one time as much as possible. And then finally, our 211 helpline, which I'll talk about in more detail, really focuses on connecting people to the resources that can help them. So 211 is a phone number like 911, but it's more than that. But that's its genesis. 211 is for everyone, we like to say, right? So if you're in need of services, whatever it is, you can call 211. You can dial that number, or you can reach out to us in other ways. We've been doing information referral at the Human Services Coalition since the mid-1980s, and we have been the 211 program for this area since 2007. And all across New York, if you dial 211 on your phone, you will get a relatively local person. It might be a county or two away, depending on how big or small your community is, but a relatively local person who will understand kind of the range of human needs and also be familiar with services in your community. So it's a place where you can reach out, get some assistance. If you don't know, we've been seeing, since COVID, we've been seeing a larger percentage of people contacting us who maybe have never needed support before, but they've lost their job, they've had a health issue, they have become disabled, and so there are folks who maybe are reaching out who haven't had to ask for help before. And then there's other people who maybe have been in systems for a long time and they've exhausted what's available to them, and now they're looking for more ideas. So we have a lot of people who reach out to us. Just to give you a little idea of what does it mean to be a 211 program, what does information and referral mean, right? Information about programs, helping folks to be able to understand their options, about what they need in their life, and then making referrals to programs that might assist. So an example could be, I'm not sure where my next meal is going to come from, and I have 2 kids, and I just don't know what I'm going to do. You can contact 211 and you can say, here's my situation. It's anonymous. You don't have to share your whole life story. You can share as much as you want. Sometimes people do. But you can give that information and say, okay, well, where are you located? You're in Lansing? Okay, here are some nearby ones. Are you downtown Ithaca? Here are some options. And then maybe we can connect you to some longer term programs that might be able to give you some financial support or get you some assistance on a more long-term basis. It's 24/7. We are locally staffed Monday through Friday during business hours, but we have partners up in Rochester that take it in the nights and weekends. It's free, it's confidential, it's multilingual, and international network, even up into Canada and moving into some other countries. This 211 idea. We have within our staff generalists who really are expert on lots of things, and specialists, like you'll see in a second, our transportation specialists, who really dig down in a program area. We have a database with about 2,000 programs and services, so nothing's really a surprise when people call us. Though sometimes we get some unusual ones. We do have programs that we've never referred anybody to. So 211 is it's a phone number I mentioned. You just dial 211 from most phones, but we also have an 800 number. Sometimes if you're on the edge of the county, like you're far north part of Lansing, and you call, it's possible to be routed up to Rochester. So we have an 800 number that also points that way. You can send a text message to 898-211 or TXT211, and it'll say, what's your zip code? And if it's a Tompkins County zip code, it comes to us. We have an online chat at our website, 211tompkins.org. Online chat is surprisingly popular still. So nice way if you don't really feel like making the personal connection with your voice, is to chat your questions. Search our database at 211tompkins.org, and also visit us in person. We're on the Commons or above the M&T Bank building, the TC3 building, on the corner of Tioga Street and Seneca. So we can be people stop in all the time, especially for transportation. There's a number of partnerships that we do. I'm just going to show some different logos of folks that we work with, but not really get into that. But just to let you know that we serve as the, because we have a phone center, a contact center, we can serve as like the front end for other not-for-profit initiatives with, they don't need to stand up a whole call center, but we can do that for them. So it's a nice way to get different services available to people without having to do some overlapping work. I'll wrap up kind of my general 211 conversation and move into transportation, but just showing you kind of our contact volume. So over the last few years, we've been hovering around 16,000 contacts a year. That's up about 20-25% from pre-COVID. You can see a big spike in 2021. We were doing transportation to the mall. If you remember going up to the mall go down to the mall to get your COVID test. We set up transportation. It's one of the big transportation things we did that period. We were getting transportation for people who couldn't make it there on their own. And then also we were supporting Tompkins County and helping to register people who didn't have internet access for their COVID vaccines. So that was a kind of a spiky year. We had about double our contacts. A little wild, but it was wild for all of us. We've stabilized now at our kind of new normal, which is that need is approximately 20%, 20-25% higher than it was before. I think it's interesting when I do presentations. I always think it's interesting to share with folks, like, what are the big themes of things that we're seeing? And what we see, we serve all of Tompkins County, as, a lot more need around housing and rent assistance. And, I mentioned earlier the connection between needs. Housing is not a separate need from transportation most of the time. They go hand in hand a lot. If you can't afford your housing, you might be thinking about a different location. You might get evicted or have to leave, and now where are you going to go? And maybe it's far away, and then how do you get to your job, or how do you keep your kids in school? We see transportation. Transportation is one of our big need areas. Car repairs, bus passes, medical transportation. I can't afford it. Concern about the SNAP benefit changes. Concern about paying utility bills. We get contacts from people now. My NYSEG bill has gone up triple what it was. How can I pay for this? I can't afford it. I've got $7,000 back owed. I'm never going to pay that off. And then health insurance assistance. There's a cool website if you're interested in data, if you're a data type person, it's called 211 Count. And it has you can go there, you click on New York, you drill down to us, you can see over any period what the calls are coming into 211, what people are asking about, and you can compare that to most other states in the country. So it's a really neat thing if you're interested in like the deep dive of data. But let's talk about transportation. That's why we're here. We're going to talk about transportation. At our team, I mentioned we have specialists and generalists. We have 2 specialists, Yamilka and Stephen, who are with our team specifically to work on transportation. So they spend their time assisting individuals with transportation needs, helping get them connected. Yamilka is focused mostly on community members and what their needs are. So, if you have someone you know or you yourself need some help, assistance, you contact 211, Yamilka. Stephen does that, but also has a portion of his job where he's focused on building the infrastructure of the volunteer driver networks in Tompkins County. So I think in the past, maybe you did some volunteer driving at your church. And there are groups that bring people around to different things. It might be veterans, it might be around healthcare, it might be around children. There's different groups in Tompkins County that do some volunteer driving, but it's hard to recruit volunteer drivers. It's a big commitment. You're responsible for someone's safety and getting them there on time, and you can't flake out and not show up. And, you're putting someone in your car maybe or in another vehicle. So it's a kind of a tough volunteer gig to recruit for. And so he's focusing on that and trying to build the capacity of the whole county in that area. At the Human Services Coalition, we are part of Tompkins County's One Call, One Click Transportation Center. It's a contract that we have with Tompkins County to be kind of the front end of transportation assistance for individuals who are looking for help, and for people who are helping them. So a lot of the contacts we get are not from people themselves, but about people who are helping them. They're service providers, friends, medical providers, people from churches or other kind of community groups saying, how can I help an individual? What options? Also employers, right? We got a contact from a national employer with a branch here in Tompkins County saying, all my employees come from Spencer and Tioga County and Candor, and we need to open at 4 a.m. and none of them can get here. I'm willing to pay. What are we supposed to do, right? So we see a lot of different kinds of questions. We help people to understand transportation options, we make connections to services, and we can distribute TCAP passes and gadabout passes to folks. So we've been doing that. I asked my colleague to give me the numbers, and last year we distributed almost 3,200 TCAP passes to about 900 people. This year we're doing about 900 a month, so it's really ramped up. About 30% of the passes that we distribute are to people who are homeless or are somehow involved in the shelter system. So we are seeing that individuals who are unhoused or don't have stable housing are some of the people who are also most struggling with transportation. And if you think about distributing a bus pass, I mean, if you don't have transportation to get the bus pass, it's kind of difficult. We will mail them, but our local, our location in downtown Ithaca is really helpful because that's where a lot of folks that we're seeing are. So it's a little bit more convenient. But we have had service providers. We've brought passes to locations. I mean, you don't want to make someone wait like 4 days for their bus pass to arrive in the mail so they can do what they need to do. So we really have to be creative about how we get that stuff to people sometimes. We also can pay for an Uber if we need to. We have a method to do that. So there are different ways that you can get people where they need to go, but you have to be creative sometimes. There's a couple of partnerships that we have. Go Ithaca is one. This is a program that's available for people who live in Tompkins County. They have 2 kinds of membership. They have a kind of a general membership and an income eligible easy access membership. This is a program that really provides some support to people in thinking about like alternative transportation, not just using personal vehicle. There's an emergency ride home service. So if you're a person who typically has a sustainable method of transportation like your car or the bus, and it doesn't work out, it falls through. Let's say you carpool with someone and then it doesn't work. This program can give you a ride home that day. Your person went home sick and you're like, well, now I'm stuck. What's gonna happen? There's also a lot of interesting things with Go Ithaca. If you're interested, Google Go Ithaca. You can get credit for car share. You can get coupons for like walking and biking gear, like clothing and shoes. You get free 30-ride TCAP passes, and then you can get a discount. A lot of really interesting stuff you can get out of from Go Ithaca. And it has a a really discounted, subsidized membership for people of low income. We're also a part of the Tompkins Transportation Scout. There's a partnership with Tompkins County, TCAT, Go Ithaca, Gadabout, Bike Walk Tompkins, a number of transportation providers. It's like a web app and a website. Again, it's a method to get people connected to different resources, a way to put all the transportation options in one place for people. We've seen a lot of college students using this when they're trying to get off of campus. And this one is also interesting because it gets rewards. Like if you don't use your car and say take the bus, you put that in and then you can get gift cards and things. So it's kind of interesting. But it's a real initiative of Tompkins County to try to think about how do we make transportation information more easily accessible. And then finally, I talked about volunteer transportation. One of the ones that we help to coordinate is FISH, Friends in Service Helping, which is a program that does non-emergency medical volunteer transportation. So you have a doctor's appointment or a specialist appointment out of town. You can make a request. Tends to serve older adults and people with lower incomes, and can bring it. And you know, again, we look for volunteers for that. But it's not just for this program. It's thinking about all the different programs, whether it's the Village of Ithaca or Love Living at Home, programs that might serve. Village of Ithaca serves youth and their families. Love Living at Home is for older adults. Places like DAV used to be Disabled American Veterans, now just goes by DAV. How do they bring veterans to their appointments? Particularly, you know, if you have to go up to the VA in Syracuse or in South. So, you know, if we think about, you know, some of the needs, a real concerted effort to recruit more volunteer drivers for the programs. I'm going to wrap up for the next maybe five or so minutes talking about transportation equity. Dave passed around, or had passed around, the a thing called the TINA, the Transportation Equity Needs Assessment. And it's a lot to read, and you know, we don't have time to talk about all of it here, but there's just a couple things I want to share with you that I think are useful as you think about transportation equity. So transportation equity is the goal of ensuring that all community members have their needs met by the transportation systems that are available. In 2021, the Federal Highway Administration stated this, not a priority at this moment, but for them, but I think the language that was used in the past is good for understanding the TINA document, the Transportation Equity Needs of the TINA. So a goal of transportation is to facilitate social and economic opportunities by providing equitable levels of access to transportation, based on the needs of the populations being served, particularly populations that are historically underserved. So when we think about equity and when you read that document, there was a focus when that document was made of looking at people who historically had not been well served by systems. Whether that's still the case now or not, or whether that turned out to be true in Tompkins County, you know, varied. But when we're talking about equity, we're really thinking about who are the people that maybe didn't get the best support before, and are we listening to particularly what they're saying? A definition of equity is the consistent and systematic, fair, just, and impartial treatment of all individuals, including individuals who belong to those underserved communities. But for transportation equity, that doesn't mean equal. So if we just say, everybody gets a TCAT bus pass, that might be equal, but it might not be equitable, because if you don't live on the bus route, that doesn't help you very much. Or if you can't get on the bus because of your physical limitations, or if it doesn't go where you want to go. So when we think about equity, we're really trying to think about what do people really want to do, and what do they need to get there. Another thing that I just want to throw out to you, because you'll see it in different places, is the idea of like social drivers of health and health-related social needs. And so these are things like we are thinking more and more as a community of service providers about how the different factors in people's lives contribute to their health. We know research shows that only about 20% of people's actual health comes from their health care. And at various times, you know, if you broke your arm or you're dealing with like significant health condition, then maybe more. But throughout the lifespan, only about 20% of your health is really driven by your health care. Much more important in your overall health is like these other factors. And so they've come up with this term, social drivers of health, or used to be called social determinants of health, which is really like the conditions that we live in, right? So like, what are the factors in our life that might contribute to us having good health or bad health? So an example of a social driver of health could be access to or lack of access to transportation. Similar to that are what we call health-related social needs, and this has really taken off as a term over the past couple of years. These are the needs that you have that are contributing to that. So if your social driver of health might be like your access issues with transportation, your health-related social need is, I need transportation, I need a bus ride, I need some support to get to where I'm going. And so research is showing across the country, and even here in New York, the importance of this kind of work. So we've seen it in the last year. Insurance providers like Medicaid are now putting in New York about $2 billion into things like transportation services for people on Medicaid with certain health conditions, because they're finding that it's cheaper to just drive people around to the grocery store, get them on the bus and take them to get their stuff, bring them over to their appointments at DSS. It's cheaper to do that than to just not do it at all and expect that they're gonna be okay with their health. It's not true. If you're getting your needs met in lots of areas of your life, your health tends to come along with that as well. So now I'll just finish up with some things that we see at 211 and also in the TINA that I think will be helpful for you. You can obviously dig down in the report, but these are the things that we're seeing. Needs that we see: rural residents living far from the TCAT routes, but they don't have transportation themselves, so they still need that same service that someone on a bus route would need, but just are far away. Lack of transportation for older adults, people with disabilities, and people with low incomes, particularly again if they're not on bus routes. Challenges with getting your groceries or your other items if you don't have a private vehicle. Medical transportation is a tough one, including to out-of-county appointments particularly. And as people get older, they might need specialty care that is not available to them here. Medicaid transportation is available, but it is not completely reliable. So for people with lower incomes, they sometimes try to avoid a service that is actually available and paid because it doesn't meet their needs. So we have this kind of duplication problem, which is there's a service that costs billions of dollars to be paid for, and people don't want to use it because it doesn't work for them. Transportation access for people who are homeless, as I mentioned, or housing insecure, returning from incarceration or in crisis can be challenging. The big one is cost of repairs for private vehicles. People are holding off on buying vehicles because they're so expensive, but that means that repairing them is also expensive if your car is old. And then a lack of understanding of options, and that is leading to why we're trying to build these apps, build a one-call, one-click center through outreach, get more information. The TINA document that you have, and I think you have the 2025 update, this was a process that was conducted in 2023. It was led by Cornell Cooperative Extension and a group of other providers called the Transportation Equity Coalition. It's no longer being spearheaded by CCE, it's now at Tompkins County Planning Department. But they focused on equity. So we talked about that equity lens and the underserved or historically underserved groups. So they conducted basically like a needs assessment, but they really looked for what are the thoughts about people who were historically underserved, and the way they described that in their survey. And it was conducted by a consultant and the policy analysis department at Cornell. People who had physical or mental disabilities, limited English, people of color, older adults, youth, and anyone who had reported having a transportation challenge or barrier. So that was the underserved community, or potentially underserved community. Then they also asked people if they were, what their income level was. So they ended up in the needs assessment with 4 groups. You had the underserved by that definition and low income. You had the underserved and not low income. You had the not underserved but low income, and then the not underserved and also not low income. And so they were able to look at these different groups. So basically, when you're someone who maybe hasn't historically been underserved and you have sufficient money to support your transportation, or you're someone who's really historically, the groups that you've been in, have not had the access to the services they need and not been treated right, and you also don't have a lot of money. And so they found kind of in general that transportation in Tompkins County is pretty good. Most people thought it was pretty good. TCAT, for all the complaints, is pretty good for our community size. The transportation options are pretty good, but there's a big asterisk, a big but with that. And it's not that easy if you don't have a private vehicle. So for people who have a car, Tompkins County is pretty good to drive around in. It's not that bad. We complain about our traffic going through certain places, but it's not that bad. If you don't have a personal vehicle, it becomes a lot harder. The bus can be a challenge for people, but it's also okay. But it's like both the good and the bad. The underserved group and the people with the lower income, and especially the overlap, the underserved and low income group faces the biggest challenges, as you might expect. So some of the barriers that you see if you read the report include there's no buses when needed, either when needed or where needed. There's parking challenges, and this is one about equity. I'm involved in a lot of transportation planning stuff, and parking is really, you want to get people agitated, talk about parking. There are some people who believe that the parking downtown Ithaca is too cheap, right? It's too cheap. We should make it more expensive so people stop driving their cars into town and they open it up and it's not so congested and everything's better. And then there's other people who are like, I gotta work downtown, and they just raise the price in the garage or the street from $1 to $2.25. So now, even if I park for 3 hours, it costs me $12. So you got this kind of equity issue, like what are your options? What are you able to do or not? Information about transportation is hard to find. They did not find that discrimination was particularly common in Tompkins County, but when it was reported, it was that underserved low-income group. People with disabilities or limited English report some particular challenges. Many people feel uncomfortable traveling in any method that is not a personal car. So there are people who might be willing to try other things or do other things, but they don't feel comfortable doing it. They're not sure if it's safe. They just don't understand. You know, you might say, I'd be willing to take the bus. I don't really know how it works. And then, you know, no surprise, people with lower incomes tend to spend more of their money on transportation. The survey found that, you know, a larger percentage of people were spending more than 20% of their income on their transportation needs in that group relative to the rest. But there are opportunities too that come out of this. So one is, you know, more frequent or later buses, closer stops. One idea that Tompkins County has been trying to develop is this idea of first mile, last mile. So it's expensive to bring the bus to all you know, like think about all the range of Lansing, right? So to get the bus everywhere, it's a huge town. You can't get the bus there. But can you get people from where they need to be to the bus stop? You know, is a van going around, or can people make reservations and say, every morning I gotta go to work. Can you come and get me and just bring me to the bus? This is something that's happening in other communities and something that folks are working to try to bring more of that here. Are there opportunities to make free or lower cost transportation services? We're distributing free bus passes to people. There's different options now being supported. Can we think about solutions that bring more information to people? Coming up with apps, coming up with websites, coming up with resource guides, coming up with people who you can call. And then can we drive solutions by, you know, in conjunction with and collaboration with the people who need them or who use them? So not doing it alone. So I'll leave you with some questions. We can talk, you can ask me stuff if you want, but you know, here are some things that I would think about. I think about this, I put my little church hat on myself. Think, what would my congregation want to talk about? And so, you know, what are you interested in? Which aspects of transportation are compelling to you? But also, where's the need? What do you see as areas where you could help? What would be your focus area? Would it be here in Lansing? Would it be a wider community in Tompkins County? You know, who might you be interested in helping? We talked about different groups and the different needs they have. What different, you know, inequities might there be to address? If you've looked at the TINA, or you're flipping through it, looking at that one pager, were there any surprising findings or ones that were not surprised? Do you need or want more information? If you do over time as you're talking, you know, reach out to me and I can share what we have or get you connected with some folks, particularly at the county. What resources do you have to try to respond? What resources do you need or want? And then what opportunities and barriers do you have? So, you know, these are some of the things that I hope you will think about, both today and, you know, the next however long you're going to be spending on this. So that's transportation really quick. I could talk about this for another 2 hours, but you probably want to go home at some point. So yeah, if you have any questions, happy to talk with you. And then I think also while you're doing your thing, I'll just be around. So if you have things you want to talk about.
So based on what you know about the Lansing community, where do you think a congregation like ours could have the greatest impact?
So the question was about the Lansing community. So I was talking with my 2-in-1 staff before on Friday when we came up with a couple of areas that you might want to think about. And so I would say, you know, think about the varied groups that live in Lansing and where are they. So you have kind of I think one of the more interesting ranges of housing and residents in the whole county. So you have, you know, down in the village, you've got you know, the apartments, and you have more international folks, but you also have more connection to bus service. You have, you know, as you get farther out, you have more rural residents, and you have kind of a mix of very affluent and not as affluent. And so I think depending on what you're thinking about, the areas could be, you know, supporting people who have maybe more needs, but are also more connected, you know, in more south, kind of in the village area. Thinking about rural residents, particularly lower income or older rural residents, is an area when we get requests from Lansing, it tends to be folks who are far away from services and are needing to get, you know, typically into Ithaca, but sometimes to medical appointments outside. We don't have a huge, I wouldn't say we have a huge pool of people. Like, I think we had 80 or 85 transportation calls from Lansing last year, so it wasn't a huge number. But also, I think, you know, when you don't think services are available, you're not likely to call because you feel like you already have your answer. You know, so and I think, you know, in a community like this, you know, especially if you're older or you have been, you know, living in, you know, or maybe you've been farming, or maybe you've been, you know, living more like that. I'm going to solve my problem myself. I'll solve it within my networks. But as people get older, or they need to get to like Sayre for a doctor's appointment, or to Rochester, your network maybe fails. You know, you can't help you, and that's when we tend to hear from people. So I think you know, think about, you know, what areas, what are the different groups that you might be able to respond to, and then that would drive kind of the need to some extent. Is that helpful? Yeah.
Is Gadabout part of your services too?
Absolutely, yeah. Gadabout has been part of all of these groups. Gadabout is another one that we can distribute free passes for. I think we did about 50. It was not quite as much, partly because the Gadabout has more of a lot of people are already using Gadabout, and they're kind of known. And also their price point is not super high for the people that are eligible for it, and they have some options also for subsidizing. But yeah, Gadabout's been part of it. They're part of the planning, and they certainly are, like that approach. Like when you talk about the first mile, last mile idea, Gadabout is often raised as a potential model for how you might do that kind of thing, right? So Gadabout brings you from one place to the other, and you make an appointment, and they know, and it's a smaller, it's not a full-size, big city bus. So that model is one of the things that, you know, planners are looking at around, could a Gadabout-like model be how you try to do that getting people from their home to the bus stop kind of thing.
So those 85 calls that you got from Lansing, then would you be able to share the information, not about the names, but what the challenge was and how it was solved, or what you didn't have so you couldn't solve it?
Yeah, so what we have, so at 211, we have a database that we use, and we have, you know, the contacts come in, and then we're able to match the need to a referral. So if you were to call and say, you know, take something that's not transportation, right? I need, you know, health insurance assistance. So we would say, you know, call came in on the 15th at 11 a.m. and we connected it to health insurance assistance, and it met the need of, you know, looking for private commercial health